Well, good afternoon. We're going to get started. So good to have you with us this afternoon. My name is Angela Birch-Acatree. I'm a Deputy Director with the Early Learning Team at the Hunt Institute. And for the benefit of those who may be joining us for the first time, the Hunt Institute is named for Governor Jim Hunt. He was a four-term governor in North Carolina, known fondly as the education governor. He did a lot for education in the state and specifically early education. We serve as an education policy support for governors, state legislators, other state level elected leaders, and we cover the full spectrum of education policy from prenatal and early childhood through college and career. This is our early efforts webinar series, and we focus on the early childhood portion of the continuum in this series. So before we begin, just a few housekeeping items. We will be using the Q&A box at the end of the webinar. We'll take some questions from the audience. So you can start populating your questions there as soon as you have them. Please know that the session today is also being closed captioned. You can find access to that at the bottom of your screen. You might have to click the three dots to find that closed caption option, but do that and then it should stay appeared for you. We are also recording this webinar and it will be available on the Hunt Institute's YouTube page in a few days. We'll also send out an email after the session to make sure everyone has that link with any post email or post event resources. And I'm going to let's see, Christy, can you take that chat and make sure that it's available to everyone? I'm here with my colleague, Christy Moore, behind the scenes, providing support. So thanks, Christy, for that. All right, so the pandemic did a lot of stuff. And one thing that it did was to bring forward the importance of children and family or child and family mental health. Trauma-informed practice is growing in the area of early care and education across the U.S. The infant early childhood and family mental health is a cross-disciplinary field, which includes endorsement for early educators at the infant family specialist level. So we have our panelists here today to talk about infant and early childhood mental health. The Alliance for the Advancement of Infant Mental Health has established 36 state associations across the US and internationally in Ireland and Australia. IECMH is a cross-collaborative between child welfare, psychology, education, and early intervention professionals. So today we're going to talk about the importance of mental health and how infant mental health cross-collaborates with education. We'll also have a chance to chat about some legislation surrounding mental health for families and educators for children from prenatal to 8. We are joined today by our panel of resource experts. We have Lieutenant Governor Suzanne Crouch, who served the state of Indiana from 2017 to 2025. We have Dr. Valerie Alloy, who is the Chief Bureau of Grants Administration from the Ohio Department of Mental Health. And we have Kelly Sipotz, who is with the Alliance for the Advancement of Infant Mental Health. Thank you so much for joining us all today. We're going to start off with our first round of questions. Kelly, given your infant mental health expertise, why is infant mental health important for a child's overall development and well-being?
Well, thanks, Angela. I wanted to kind of start real quick to just name kind of two parts of what I would bring. So by trade, I was a direct clinical infant mental health worker for 10 years, doing infant mental health, home visiting, clinical work with families. Then when I moved over to the Alliance, that's where we started to do more of the direct policy work and kind of the more like larger bigger systems work. So kind of how Angela had said at the beginning, the Alliance is the international home for the infant and early childhood mental health credential that Angela had mentioned. There's 38 states and countries kind of across the globe that use this international credential as a professional resource, workplace, professional advancement that kind of helps to move the field forward. So when you first asked that question, I'm like, oh, at heart, I'm a clinician. So like, of course, infant mental health is so important because we know those first few years that sets the foundation everything for everything a family needs, for everything a baby needs. When we work in that time frame, we're not working with just that time frame. We're setting the ground for everything: social and emotional development, physical development, kind of all aspects. So from the clinical side, infant mental health is so important because we need to get right in there and help support all of those early relationships that are going to kind of be that foundation forever and ever. From the policy and the systems perspective, that's where I like really truly advocate for like, then what we know babies need, we know the workforce needs. So we need to be able to get in there, provide opportunities, trainings, reflective supervision, growth points for the workforce so that the workforce can help to, support those families and support those babies. So I guess in short, I'm like, we know it's so important because it is that foundation and we need that foundation. And it's those relationships that are, so crucial so early on.
Indeed, really thinking about it as the foundation and thinking about it in terms of brain infrastructure, that those relationships are building is definitely key, and lets us all know why it is indeed so important. Dr. Alloy, we'll move to you. You have extensive expertise in both clinical and management settings, specifically focused on early childhood mental health. What services and supports are available to infants and young children, their families, and early care and learning providers to build resilience and address mental and emotional health needs? You can speak to Ohio and nationally if you can. Oh, and you're muted, Doctor.
Good afternoon, and thank you, Angela, and my co-panelists and everyone joining today. Early childhood mental health is such an exciting field, and as Kelly has mentioned, a foundational field for our young people as they start and across the lifespan. One of the things that I want to draw attention to today is to really understand that infant and early childhood mental health builds the capacity of the adults that care for children. And I think in this moment in time, I want to take a moment to highlight that in terms of early childhood mental health professionals in whatever settings we find ourselves in, early learning settings and home-based settings, really bring a lot to the table to support the adults that care for children. And the other piece I want to highlight is that if we look across the country in terms of the research, I lean into my colleague, Dr. Walter Gilliam. I'm sure all of us are very familiar with the Center for the Developing Child. That research is about that relational context. And it's critically important that we have healthy adults whose needs are who are taken care of so they can optimize what happens for children. I just think that's the moment is speaking to me right now to talk about that. The other piece I want to touch on is as we think about what happens to young children in early learning settings, again, leaning into the research, it's about the well-being of the caregiver, the lack of stress, the ability to manage depression, anxiety. Those are the decisions that result in often what happens in those interactions. So right now, while we're at a heightened sense of anxiety and stress, I really want to lean into the part that talks about making sure that our workforce, our caregivers, our parents and families are getting the support they need to create a healthy ecosystem for our young children. Right now, the area of infant and early childhood mental health has, I want to use the word exploded. It has expanded across the country, and you're finding professionals in all settings, in early learning and care settings, in hospitals, in mental health settings, in early intervention settings, in home visiting settings. We're really doing a huge cross collaboration to make sure that the basic skills that are needed are available to all individuals that interface with babies, children, infants, and young folk. And it's an incredible time for our country to recognize these needs, the relational needs, the foundational things that help babies have good, healthy minds, and then young people develop those soft skills that we know are so important to take us through life.
Indeed. Thank you. Yeah, that I think is pointing out their research, and the extent of research is really important. This is not just a nice idea. It's not just something that's good for people who are feel good. This is really important for everybody, and it's definitely based in research. Moving on to Governor Crouch. In 2021, you formed the Indiana Mental Health Roundtable. What takeaways did you learn about how policymakers and government institutions can support or expand services available to address early mental and emotional health for children, families, and early learning professionals?
Well, thank you. And thanks to the Hunt Institute for, inviting me to participate in this and to be with such distinguished panelists. But, I co-founded the Indiana Mental Health Roundtable because it was during COVID and we saw how we were all struggling, but particularly our young children who were receiving the stress from their parents or their caregivers was being passed on to them, along with the stress that they themselves were experiencing. In 23 and 24, the Roundtable held summit, and we had over 500 people attend each summit, many of them nationally. And we focused on what we can do to be able to move the needle on mental health. Some of our segment was focused on children and young children. And what we learned, to piggyback off the doctor, is that the first few years are extremely critical in terms of being able to form attachments, which ends up being very positive with a child's mental health, particularly that first year. But it's also important that a child is able to attach with a healthy caregiver, where it's a parent or whether it's a family member or whether it's with that caregiver. And so we had multiple discussions and sessions about that. Kind of the major takeaways from that discussion was we need to focus on intervention. We need to focus on prevention. We need to focus on promotion, but we also need to focus on upstream solutions. It's not just about the stressors that a child feels in their home. It's about the stressors that push into that home that actually affects a child's mental health and well-being. So, it concerns me. I don't know how, if it can, I'm sure it concerns the other panelists, that those children that went through COVID are going to approach life totally different than we did. And so we need to be sure that we have the support for them and that they have the well-being to be able to embrace life and to be able to overcome challenges and not be afraid. I had a mother tell me recently that we are raising a generation of children that are afraid because of what they went through with COVID. And so that really affects a child's mental health. We need to be sure that early childhood education is supported in our states. I think we could do a better job in Indiana, although we're doing good work, but we could do more because it's so very much can counteract perhaps some of those stressors and toxic stress that a child gets that are out of their control and sometimes out of their parent or their caregiver's control.
Right. Thank you for that. Yeah, I think we're still discovering many new things about children and what they experienced through COVID. Certainly it's been, I think, talked about a lot in terms of like teenagers and their experiences, but I think we're still learning a lot about how that affected those in that 0 to 5 age range. They're just starting kindergartens. Those COVID babies that were born are just starting kindergarten, and we're really learning a lot about how that affected them and their caregivers. If the caregivers cannot don't have the supports to maintain their mental health, it gets passed on through the children as well. Great work that you have done and are continuing to do in Indiana, and I think it's true for most states that there's still some room to grow in this area. Dr. Alloy, back to you. What is the role, Governor Crouch mentioned early childhood education and the supports needed to make sure that that is available for children. What is the role of early childhood education in helping to address and promote positive mental health and setting children up for success? You're muted, Dr.
Unmuting. I'm trying to be good about staying muted. Thank you so much for that question again, Angela. And Governor Crouch, again, appreciate all that work you spoke to that you did along with Kelly. I think we are at a moment where we must collaborate. Collaboration is the key word I want to lean into, and making sure that we are standing up all parts of the village. Early educational professionals have children a great deal of the time, and so they cannot do that work alone. Making sure that we have the evidence-based practices, but there's a step before that, making sure that we are providing the necessary resources, financial and human, so that those evidence-based practices can be available to the workforce wherever they are. I think another important thing to me is they say that early learning is not rocket science. I said it may not be rocket science, but it does take a science-based practice to implement it well. So we all need to be aware that there's growth and opportunity in our understanding. And we just mentioned this COVID time. We're in an unprecedented moment. We don't have a lot of research on exactly what COVID did across that lifespan. We're going to be uncovering that for years to come. So I appreciate the attention that we're giving to making sure that the needs of the children that are our COVID babies that are getting into our early learning environments are having enough support in terms of trauma awareness, trauma competency. We might be looking at that in terms of post-traumatic stress response on the adults and the children. So I think early learning professionals play a pivotal role in screening, identifying, collaborating, making sure that the resources that are needed are coming into the table. Developmental disability, or I would like to call it opportunities, right, for good development. All of those areas are part of this work. And I think the early learning professional and educator really sits at the center of that table, bringing that collaboration together because they're seeing the child more than any one of those particular parts.
Yeah, thank you. It's really, you know, it's always kind of hard to tell if as many children who need early intervention services are receiving it, because we can't really gauge that number of need, but we know that the services provided are generally not reaching the population that it needs to. And I think that mental health can certainly be included in those early intervention because it can be mitigated. Those results can be, or those outcomes can be impacted by some early intervention and getting some good practitioners in that child's life that can help and support them. Kelly, back to you. In your role, what do you believe are the challenges faced by the national and international workforce working with infant and early childhood mental health? And what are some of the ways the field is addressing those challenges?
Well, Angela, when I first went to answer this one, I was like, oh my goodness, we could maybe sit here for so long and think that all through. But I guess where I just kind of wanted to highlight, because my two co-panelists highlighted so well the parallel process between the caregivers and the babies and how important that is. And we talk a lot in infant mental health about the parallel process, or if you call it the trickle effect or the ripple down effect, but just that idea of knowing a baby isn't in isolation, and so it is forever tied to all of the relationships that are a part of it. The other really important one, right, is that relationship between the workforce and that baby that's supporting kind of the family. So there is a direct impact between, baby and caregiver, and also baby and workforce, and then the workforce to the family that's supporting that baby. So the range, I think every day the workforce is kind of hit with some new challenges, some new things that have kind of happened. And so whether that looks like funding things that are coming up, or language, or the use of language, or any of those. I think two of the biggest things that we hear across the globe, whether it's specific to an area of the US or kind of internationally, is burnout, and kind of a lack of burnout for professionals, and then also a lack of new folks getting into the field. And so I think two of the things that the Alliance is really trying to do is advocate for the field advocate for reflective supervision as a support to burnout, really providing that reflective holding experience for the workforce so they can go into these homes and go into the child care centers and support these families. So we're learning a lot about reflective supervision as far as the research goes and its impacts in bidirectionally, right? The effects of reflective supervision through a system, and when reflective supervision can be added to a system all the way down to, to our little ones. So I really hope we do that. And we also are really working to help support kind of the lack of training around certain areas. Endorsement provides a space for a professional to kind of take a look at their whole journey and kind of see what knowledge and skill areas they have up to this point, and then identify for themselves, oh goodness, I haven't had training on pregnancy in a while, or I haven't had training on reflective functioning. Let me go seek out those trainings. The Alliance can be a place where AIMS and resources all across the globe can share trainings. And so a professional can go and be like, oh, I would love training on reflective supervision, or I'd love training on the effects of in utero trauma, and be able to access that. It's kind of one of those benefits everybody spoke about earlier, like COVID, right, did open up this way for us to connect internationally and share training resources and webinars kind of across the globe. So the Alliance really helps to do that, to kind of help support the workforce. And then, we are so much stronger. I think Dr. Lowe, you said this, we're so much stronger when we collaborate and come together. So the more work we can do across state lines and across the globe for initiatives that have worked for this state, who then another state can replicate it. The louder our IECMH endorsed voice becomes, the bigger that number becomes, the more traction we can gain, and hopefully the more we can move the needle forward to support babies.
Definitely. Thank you, Kelly. A lot of great pieces there. I think for the practitioners that really support infant and early childhood mental health, making sure that they have the resources that they need, in all the particular, like you said, in utero trauma, like who really knows about that? That's a very complex topic, and making sure that they have the resources they need to be able to address that, and the folks that they work with. Governor Crouch, why have you chosen to highlight mental health? How critical is it, in your opinion, to the health and well-being of children, families, and overall communities?
Well, to me, it's everything. And, I'm very passionate about mental illness and addiction because my mother struggled with depression. My older brother, Larry, was an alcoholic, and he drank himself to death. My youngest sister, Nancy, died by suicide. And so when you grow up with family members that have struggled through no fault of their own, and genes they inherit, in fact, we don't pick our genes, right? If we did, I'd maybe be a little different. But, we have to give those people a chance. A family member said to me, life's not fair. And I said, no, it's not. We can't control the hand we're dealt, but we can control how we play it. But we have responsibility to give people good cards to play. That's what we can do by supporting mental health and by supporting early childhood education. We can give those children that have come, from circumstances that they have no control over, that opportunity to be successful in life. In Indiana, we have about, I think it's about 500,000 children that are, early childhood age. And 63% of their parents are in the workforce. For every dollar we spend in early childhood education, it saves $16 in Indiana. And so the cost of untreated mental illness in Indiana is $4 billion a year. So we get more help to families, to children, because oftentimes the children have parents that are struggling with mental illness and addiction. We get help to the entire family unit. We're going to have successful children down the road. I always say we can pay now or we can pay later. We can pay now or we can pay later. And so to me, it makes so much sense to be able to support early childhood education, which helps support that child's mental health. As I said, I don't think we do enough. I mean, I was on a panel with the lieutenant governor from New Mexico, and they have universal, fully funded early childhood education. I wish every state had that. You know, what an incredible opportunity we would give our young people if we were able to do that, because early childhood education helps them overcome some of those mental illnesses and some of that trauma and toxic stress they may experience through no control of their own.
Exactly. Yeah, New Mexico is doing great things. Lieutenant Governor Howie Morales has spoken to some of our audiences before, and they're doing amazing things as far as early childhood, but would probably also admit that there's a little more room to grow there as well. But if the rest of this country could get to where they are, we would all be in a much better shape. What you just explained there, Governor Crouch, about, helping to address these issues that these children are facing through no fault of their own, it really, to me, becomes an equity issue, right? Allowing everyone to start from the same place, regardless of their background and circumstances. And the fact that across the country, the average is about 66% of parents working, or all parents in the home working for children age 0 to 5. There's a huge opportunity for early childhood programs to become a source of support for these families and for these little ones.
And if I can interject, which,
please do.
Tell me if I can. The thing is, in Indiana, early childhood education was driven by the business community. They saw the advantage to getting early childhood education for future workforce. And they really were the ones that pushed early childhood education back in 2008. We've got to engage them more because they are the ones that are affected by us not having a productive, well-trained workforce. I mean, it affects their bottom line and the rate of a return. So, somehow we've got to figure out how to engage the business community more. And I don't have, a silver bullet on that. Perhaps perhaps my fellow panelists have some input on how we can better engage the business sector. And because they're the ones that can drive legislation, they're the ones that can drive initiatives and programs, and we get them engaged and we can move the needle even more.
Absolutely. Yeah, recent research showing billions of dollars being lost due to childcare challenges, lost through just straight revenue, lost through taxes to the states. So it's just a huge impact that not having adequate childcare has on the business community. You mentioned legislation and the impact that the business community can have on some of those. I'd like to hear from all the panelists on our last question here. What are some of the trends in legislative initiatives that are focused on early childhood mental health that you've seen either in your state or across the nation? What should folks be looking out for? And just a reminder for our audience, after this, we will open up for Q&A. So if you put your questions into that Q&A function at the bottom of your screen, we will get to those after the panelists address this question. So I will leave it open to who wants to jump in. What positive trends and legislative initiatives have you seen focused on early childhood mental health?
Well, I'll keep talking because then I'm going to shut up and let my fellow panelists speak because they are the experts in this area. But in Indiana, we have had legislative accomplishments. We passed the On My Way Pre-K. I was a co-author of that legislation back in 2008. We also, the private sector has been engaged, and we're very fortunate in Indiana that Eli Lilly Company is headquartered in Indiana. And so they have put $70 million into the Early Learning Indiana, which is our largest child care provider. They have given them $70 million to put in place programs that support the mother, that support the child, that supports the caregiver, that is focused on low income, that is focused on infants and toddlers, that is focused on developmental needs, meeting the developmental needs of these children. So we're very fortunate to have a benefactor that is so supportive of early childhood education. We also use a 1.0 approach and a 2.0 approach. 1.0 approach actually is legislation or initiatives that directly affect the child and their caregivers. But the 2.0 initiative is focused on the upstream kind of initiatives. How can we ensure that families have adequate food? How can we ensure that they have good housing? How can we ensure that they have jobs? You know, how can we eliminate stressors that actually push into the home and will affect the mental health of that family and ultimately the child? So that's kind of been our approach in Indiana. Like I said, we've done a lot, but we can certainly do more.
Thank you for that. That's a great jumping off point, Dr. Alloy.
That's a hard act to follow, Governor Crouch, but that's impressive. And we commend Indiana for that vision. There have been a few significant pieces in Ohio that have helped to move the needle and what I call sustain the needle. So we had a piece of legislation introduced by Senator Peggy Lehner in 2019 that helped us to establish a preschool expulsion prevention initiative, where we made sure that there is mental health screening, children just weren't being, expelled for any reason, and we put in several safeguards against that. That's been very, very helpful. We are in budget season, most of the states are, and we have seen continued, or I would like to say sustained, a general revenue line item for early childhood mental health consultation. That's been huge for us. And so as we work through budget season, it's our fingers crossed that it will make it out of the budget. It has been in the budget the last 2 bienniums. And so we're hopeful with the establishment of a new child and family agency that those dollars stay put. That has been foundational to making sure that the workforce can be sustained and has some consistency. There are other dollars that actually came together to build Ohio's pool of dollars in the space, but that's been an important one in terms of legislation and keeping those in the budget. We're very concerned about our preschool tax credits and how we can get young children and families supported in terms of the cost of healthcare, of early learning care. So that's very, very important. And really just leaning into all of our third party, our managed care organizations to ease the burden of access to basic mental health care. Governor, you spoke to that so much. The mental health needs of our community right now are extraordinary. We believe COVID, while exacerbating that in some cases, really just shined the light on the crisis that's already happened in America, and with the opioid and addiction epidemic kind of taking forefront. So I think there are many, many, many things that we need to be doing. And I'm intrigued by your thoughts on how we can engage our business community to have a louder voice and to have a stronger presence in making sure that the needs of the workforce are taken care of so that we can get healthy citizens. Before I turn it over to whoever wants to speak, listening to the panelists, I'm reminded of a quote I made a few years ago, and it goes something like this: when children come to school healthy and ready to learn, that's a win for the child and the family. When educators can take children to the next level and successfully educate them from preschool to kindergarten to 3rd grade to graduation, that's a win for our communities, right? And then the third win is when we have healthy, educated young people entering our workforce, our society wins. So early learning and education to me is always the win, win, win. It makes no sense to do anything other than that.
Absolutely. I love that. Win, win, win.
Win, win, win.
Well, I mean, the biggest hand snaps to everything that was just named ahead of me. And I guess I wanted to take a moment from the Alliance perspective is to highlight, because I do think that right, Angela, there's folks across the whole country from all states. So it's like one of the things I can highlight, the Alliance is the nonprofit that pulls all the states together. So wherever you are across the globe today, I would say look for your state AIM. So there are infant mental health associations across the whole alliance. If you are from a state, I'll make sure in the follow-up that the link to the alliance gets posted in there. So you can look to see if you are in a state that has a state infant mental health association, affectionately called an AIM, an Association for the Advancement of Infant Mental Health. That is going to be a great resource for you to connect to see what needles are being moved in your state. Lots of AIMs will be the holder of trying to do research or advancing policy work or things like that. So if you are, if you're in Indiana, Infancy Onward is an amazing state association that's doing a lot of work to advance infant mental health. And that state then brought the international credential to the state to support the workforce. So then there are movements within the endorsement that certain sectors of the workforce have to be endorsed in order to do the work, which provides baseline support to the workforce, provides that reflective supervision, those trainings, those modules. New Mexico, that's so amazing that you guys named New Mexico, because New Mexico has tied behavioral health reimbursement rates to endorsement. And so to kind of have this double movement where they set a workforce standard and then have been able to tie policy to that workforce standard to ensure better outcomes for babies. There's been lots of movement like that kind of across the globe. Michigan's done certain things. Texas has been able to do certain things. So to that, I would say, connect with your local AIM, connect with your state AIM, and see, what kind of amazing work is already being done there, and then see what else we can do to keep it moving forward.
That's great. Thank you, Kelly. Yeah, it's always important to know where those state level organizations are that will be working in conjunction with your passion, whether it's specifically early childhood or infant and early childhood mental health, who is your advocates basically that are working to push these initiatives forward. Thank you all so much. We're going to turn to the question and answer. We have some questions in our question and answer function. I try not to call it a box because we have the chat box and have the Q&A function. This particular one that we're going to start with, I think maybe top of mind for many folks. Can any of the panelists speak to the role of Head Start services in filling gaps in early childhood mental health services, specifically for low-income families? And if things continue in the way they are progressing, where could those families find supports if that program no longer exists?
Wow, this is a big question, particularly as we're seeing shifting winds in our current country. We know the history of Head Start, and actually it was the cradle of early childhood mental health. So we know that early Head Start really was the footprint in that space. And it continues to be a driving force for many families, not just low-income families, to get quality learning and education experience, as well as access to infant and early childhood mental health. I think the message that I want to give is first to make sure that our faith is stronger than our fear, no matter what comes our way in the future, right? Let's keep our faith stronger than our fear and know that our communities are strong. We've talked about our business communities. I'm going to talk about our philanthropic communities, our faith-based communities. We have many reservoirs of strength, and those entities may need to come together in a roundtable to look at gaps that might emerge if winds continue to blow strong, that might disrupt some of the opportunities that we have seen be most beneficial for all children.
Thank you. Thank you. That's a great way to describe that. Go ahead.
It's interesting at our summit, our mental health summit last year, mindful philanthropy came. I don't know if you're familiar with mindful philanthropy. It's, as I understand, it's like a national association for philanthropic groups and organizations and foundations. And what they said was they did a study, and I'm hoping I'm getting these numbers right. I'm pretty sure I am. And they said only 1.8% of all philanthropy goes to mental health. 1.8% of all philanthropy goes to mental health. And so they're charged to their association members is get it up to 3 to 5%, which would inject billions of dollars into that space. And so to your point, Doctor, we can't just depend upon government to take care of everything. You know, we need to collaborate, as you said, and engage the business community, the philanthropic community, so that we can ensure that we keep moving forward.
Thank you, Governor.
Yeah, I mean, I was just
Thoughts,
gonna
Kelly?
really think it's that connection, right? I think we lean into the network now more than ever. We lean into each other. We lean into all of the creative thinking that we have out there, to be able to help, come together. It is every day can present new things, new headlines, new things that we have to address. And the more we have been able to lean into the network, lean into each other, come up with a different way to kind of phase what we need to do to stay strong to what we know babies need, but maybe be able to spin the way we need to be able to name it, call it, do all the things, has really been a strength. And just being able to know we're not in it alone. Like we're not the only people sitting in our offices trying to figure out what to do. We have a strong network of folks that really believe in relationship-based work and the power of relationships for babies early on.
Definitely. Yeah, thank you. So I'm hearing collective hope. There's good reason for collective hope as we encounter these shifts. And we will lean on that for sure in the coming days. Looking at the Q&A again, Lieutenant Governor Crouch, you mentioned the amazing work taking place in New Mexico. We know that early learning and infant early childhood mental health is a bipartisan issue. What needs to happen to have more political will to move this model in more states?
Well, we need more women in the legislatures. But besides that, we need to engage the business community. As I said, they're the ones that were responsible in Indiana for our early childhood education program back in 2008. I don't sense, at least in Indiana, that they're as engaged now as they were then. Other issues have kind of risen to the top and taken priority. And it's up to us to re-engage them because they will drive policy. When they become engaged and involved, they will make a difference. So to me, that's where our success lies, is being our ability to be able to engage that business community. And like I said, I don't have any silver bullets. I know that each and every one of us can go out and talk, to as many people as we can. We can engage chambers, we can engage associations, we can try to touch people as much as we can. But in my mind, that's how we continue to move forward.
Thank you. Yeah, just keep pushing that ball. Eventually the conversation will be had with the right people, and again, the collective work and collective impact. I wanted to give Kelly, Dr. Alloy, an opportunity if you have any thoughts or comments on how we can push this forward as a bipartisan issue. And it's fine if you don't.
Yeah, I didn't have any specific kind of thoughts there, except, yeah, I mean, I think the idea that, especially from the Alliance perspective, we see red states and blue states who are like having to navigate their areas. And so I do think it's like that ability for everyone to like take a deep breath, kind of self-regulate, hold what we know to be true, and then find the way to speak about it in that moment, like the way that you can, that still pushes things forward. And loads of creative thinking and loads of, coming together to creative brainstorming on how we can say. I think I saw someone say, like, why can't we use brain health instead of mental health? And we've had people in some states, they can't say social emotional learning anymore. So we've had to be able to come up with how can you say that without saying that? And red states learning from blue states, and blue states learning from red states, and being able to kind of come together to find some language that is universal, that we all hold to be true, that can help move things forward.
Mm. Kelly, I was leaning into your idea of the holding space. I always like to be a little bit reflective before I speak. So one thing that occurred to me is that in every red or blue state, there are both sets of many points of view, right? So nothing is either red or blue, nothing is black or white, right? We are a community. And so I think the really important thing that I'm looking at is the opportunity to understand that the health of our communities belongs to all of us. And so I really want to advocate, right, that we reach not just across the aisle, but deep within our communities to say that the welfare of children and babies and families is everyone's concern. It's not red or blue or yellow or green, right? It's everyone's concern, and build that type of, we call bipartisan, but really I want to call it universal appreciation of having healthy families, healthy babies, healthy communities. And I think that could cut across all lines. I think the other thing that rings to me, thank you, is the idea that we are a family. We're a family, and we all have to support everyone. It's easy to become divisive right now and want to fall into different camps based upon, a different point of view. But the fact is, it's the health of our nation that is at risk. And it's everyone's responsibility to step forward for a healthy America all the way around. And that's really that's the deepness of that I feel about the issue. I think we can weather these winds and come together and reach into new ways of responding, bring new partners to the table, try to be stronger, yet understanding that people's lives are at risk, babies are at risk. And that to me brings an urgency to the work. No one can sit on the sidelines right now. Everyone should be standing up and having a voice in what their community looks like.
Thank you, Doctor. Yeah, and the key to a lot of this messaging is finding what you have in common. We all want healthy babies. We all want healthy, strong families. We all want kids to be prepared when they start school. We want parents to be able to go to work and put food on their children's tables. So finding the way to communicate that to your particular audience is indeed the challenge. We are coming up on time, just a few more minutes. I kind of want to, this is taking it in a slightly different direction, but somewhat the same as we look at policies and legislation that is in place. One last question to wrap it up. What are some significant factors that influence mental health in the first 3 years? So we talked about relationships, but what are some other significant things, perhaps positive or negative, that can impact babies that we need to be aware of as we come into this different time in our country, and the services that may or may not be available?
And I'll kick it off and then turn it over to my panelists and I can be quiet. I love the idea of Maslow's hierarchy of needs. And what I like about that is I call it the house that Maslow built. Basic needs are universal: safety, food security, housing. When those needs are met, parents can provide their children what they need, right? And then to the second level of needs. So I just lean heavily into the idea of understanding that babies are a part of an ecosystem, be they in utero ecosystem, out of utero ecosystem, and those ecosystems have to take care of human beings' basic needs: safety, security, housing, and food. Once we have that, and those are still have variability in our country. Housing is a shortage. Food scarcity is still an issue that blows my mind in a society like ours, but this is where it is. When those things are level set, then people have a chance to really grow and excel. So I really just want to say, let's make sure the house that Maslow built stays built with people's basic needs taken care of.
Love that. Kelly, any thoughts?
Yeah, I was just gonna, I love kicking it off that way, Dr. Alloy. And then I think just because I think you had said, Angela, too, many people on this call are like the systems level people. I think from the perspective of the Alliance, it's it's the parallel process too. So just like you spoke about, Dr. Lay, like all of those needs, and then you can look at it bi-directionally. So look at a system, what gaps does a system have? What are those basic needs that a system kind of needs in order to provide? Look at your workforce, like what gaps might your workforce kind of have? And then when we can support those, that trickles, all the way down. So we just kind of want to hold into that ripple effect, that parallel process, and think through how it impacts all the different levels of that system.
Thank you. Yeah, definitely an ecosystem, right? One thing impacts another. There's nothing about families, children, the supports that they need that exist in a silo. So Dr. Loy, I love what you said about if, parents can provide what their children need if parents have their needs met. And I think that's a truth that a lot of parents need to embrace. They feel like, they may not maybe have what it takes. How did we get into this parenting situation? You look at the little baby in the hospital and you're like, oh my gosh. But you have it. You have what that baby needs. If we can support the parents and make sure the parents have what they need, then they can support their children. I think that's a great note to end this on. I appreciate the conversation here. We'll close out and give folks a few minutes back in their day. But thank you again, Kelly. Thank you, Dr. Aloy, and of course, Lieutenant Governor Crouch. Thank you so much for the work that you're doing in your communities for this effort for children and families and for their mental health. But thank you for joining us today to share that expertise with our audience. For those on the call, look out for information about our next early efforts webinar coming up in June. It will be about early literacy. We'll have some more great panelists to share their expertise and experience with you. And until then, you can find that library of resources on the Hunt Institute YouTube page. Thanks again, everyone, for taking the time today. Thank you, panelists. Thanks, everyone, for joining. Have a great rest of your day.
Thank you.
Thank you.